Hello, welcome to Portland Public Schools Standard Operating Procedures Training. This training is around the Emergency Response Framework and the COVID-19 Response Team. The purpose of this SOP is to establish an emergency response framework and a COVID-19 response team guidelines for prevention, mitigation, and response to COVID-19 in schools. These standard operating procedures have been developed in alignment with the Ready School Safe Learners Guidance. These procedures apply to all students, staff, and visitors. It is the responsibility of everyone while on Portland Public Schools property to take preventative measures to reduce the spread of COVID-19. It's the responsibility of the school administrator or administrators to create a COVID-19 response team and ensure that all staff are aware of the emergency response framework outlined in this training. Whenever possible, response to a COVID-19 concern will be handled at the school site level in order to minimize the impact on students, staff, and the community. In the event of a COVID-19 outbreak and/or the school site requests additional support, the district's COVID-19 incident management team will reconvene. If the IMT determines that additional district resources and management is needed, the district's Emergency Operations Center will be activated to support the impacted school site. The following standard operating procedures have been developed under the Emergency Management Framework in order to prepare schools to respond to COVID-19 concerns and cases. The Symptomatic Student Response SOP, the Health Surveillance and Contact Tracing SOP, the Symptom Isolation Space Requirements SOP, Communication Protocol for a Presumptive COVID-19 Case, and Cleaning and Disinfecting Response to a Presumptive COVID-19 Case. The school-level COVID-19 response team should consist of an administrator, school nurse, custodian, and additional staff members to assist with screening, the isolation space, and data collection, as well as staff members to assist with monitoring and promoting physical distance. Administrators should be responsible for the overall health and safety of the school, convening the COVID-19 response team, ensures that all staff have received the proper training on all COVID-19 SOPs, all notification and communication related to presumptive confirmed cases in collaboration with PPS Senior Director and Communications Department. The school nurse will have authority on all health-related concerns in school, conducts health screenings, temperature checks, log and yell students, and determines if a student or individual must be isolated and dismissed due to symptoms. They also consult with the MESD nurse consultant and Multnomah County Health Department. Custodians will assist with arranging cleaning and disinfecting areas of exposure to include isolation spaces prior to and after being occupied by a student or individual. Staff members assisting with screening and isolation space will conduct visual health screenings of students upon entry to the building and throughout the day, responsible for working with school nurse to ensure students complaining of illness are logged, and if dismissed or absent due to illness, and tracking staff due to illnesses. Staff members assisting with physical distancing. To the greatest extent possible, they'll promote physical distancing requirements, particularly during peak times such as the beginning and end of the school day. Supplies and materials that will be needed will be a laptop, tablet, or Chromebook, should be accessible in the health room, and isolation space for electronic logs. Face coverings, face shields, gloves, touchless thermometer, and disinfectant supplies as needed. It is recommended that the school COVID-19 response team meet weekly to address concerns with mitigation and prevention practices and to debrief confirmed case responses. Ensure that adequate supplies of PPE are available for the COVID-19 response team. And for any corrective action, retrain staff to conform with this or other COVID-19 SOPs. Thank you.